gonna knock on the door and close the curtain for privacy. Hi, my name's Josie and I'm gonna be your student nurse today. It looks like from the physician's orders that we need to do a dressing change. So can you please verify your name and date of birth?
Catherine Stengy, 07-1802.
And do you have any allergies?
No.
All right. I would check your wristband and make sure that's all accurate. Next, I'm just gonna wash my hands real quick. And then I would put some gloves on. And I would start by removing the old dressing on the wound, and we use the push-pull method for this. So I'd use one hand to push down, and then the other one would just be used to pull up the tape. So once that's all taken care of, then I would flip this over and look at the type of drainage that's on our ABD pad or our gauze, and it looks just to be normal serous drainage, which is good. So I'd make sure to document that, and then I would throw this away. And after I do that, I'd take off my gloves and wash my hands. So next we're gonna come over to all of our supplies for our dressing change and wound cleaning. So I'm just gonna assess and look at the expiration date and the integrity of all of our materials. Make sure that nothing's open or nothing's expired, which this all looks to be intact. So first, before I open up any of that, I'm gonna list the 9 steps to the sterile field. So first, there's a 1-inch sterile border, or there's a 1-inch non-sterile border around our sterile field. You must use a sterile guard when working with the sterile field. You want to limit the time that it's open. Fluids flow in the direction of gravity, so you should keep your hands tipped forward and down when you're dealing with tweezers and gauze. Nothing sterile below the waist. Skin is not sterile. Sterile water and sterile bowl only. Know if you've broken the sterile field, if or when, and how to fix it. And the last one is never to turn your back on the sterile field. So once I do that, then I can start by opening up all of my supplies. So we're gonna open away from us. And once there is a corner visible, I can grab that. Let's see. Right here. I'm gonna open it away from me. All right, and when you lay this down, you want to lay it down away from you. And we have that 1-inch border that's not sterile. Next, I'm gonna open my bowl. Put in the paper. Okay, then we'll get our EBD pad. Okay, and we have our gauze, but first we're gonna pour, well actually I'll pour my nice gauze in. And then for the sterile solution, or the solution that we're going to be pouring into the bowl, I'm going to keep the label in towards my hand. Maybe if it wants to open. There we go. So I'm going to keep the label towards my hand and pour about 6 inches above the bowl. Throw that. Next, I'm gonna put on my gloves. So my packaging would not have been opened. With that. All right, now we are able to clean our wound. There we go. And I'm gonna make sure that this table would have been raised up to waist level at least, so then I would be putting my hands at all below my waist. But for this, I'm gonna have to go a little bit below my waist. So we're gonna start by taking our gauze that are nice and wet. Okay. Grab it. All right, so then we're just gonna go around the wound site. So if this were my wound site, I'd assess it, make sure nothing looks to be out of the blue, like there's no, when I took the wound drainage, or when I took the old dressings off, there wasn't any like bad drainage or anything like that. So I would just reassess the wound before cleaning it off. So then once I clean it off, or once I start cleaning, I'm gonna go once in a circle, make sure not to overlap at all, and then I could take this, throw it away, and we'll go on the newspaper. Then I'm gonna take the next one. Okay. And then I'm just gonna clean it again the same way, making sure not to overlap at all with my circle, and then we can throw that away. Then I no longer need my tweezers, so we can put those over there. And then I'm gonna take my ABD pad, so I would hold this, and we would use split gauze as well for this, but due to lack of resources, we don't have split gauze, so we would put split gauze down, and then I could take my ABD pad and put it on down, and then I would tape my ABD pad down to it, make sure that it's all secure, and then I could take off my gloves, and I would ask the patient if there was anything else I could do for them while I have the time.
Nope.
Then you have a nice day, and I would go ahead and make sure to document all of my findings correctly.